everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And today we have Dr. Anne Snowden. She's Chief Scientific Research Officer at HIMSS. Welcome, Anne.
Thank you ever so much. I am absolutely delighted to be here, John.
Yeah, so I'm excited to dive into all the changes to EMRAM, something that a lot of people have talked about. But before we get into that, tell us about yourself and your role at HIMSS.
My role at HIMSS, I'm actually the Chief Scientific Research Officer. I'm really leading the research at HIMSS that actually now starts to surface what's the evidence of digital health as we advance and progress towards much more transformative digital health ecosystems globally. Healthcare is an evidence-based sector, business sector. We rely on evidence to guide and inform. So HIMSS' impressive work and reach globally with maturity models, the digital health indicator tool. My job is really to use that data, leverage it, transform that data into knowledge insights to support and enable health systems to guide their decisions on how do we get from today in the health systems we have to those much more high performing digitally enabled systems of tomorrow.
Yeah, so let's talk about that from the EMRAM, as everyone calls it, the electronic medical record adoption model.
Right.
It's funny to call it an EMR still in that whole battle, but anyway, it's EMRAM is obviously something that most of us are familiar with. But what's been really the impact of these maturity models, the EMRAM maturity model?
Yeah, EMRAM is is the oldest and longest maturity model in market, now over 15 years.
Wow.
And it's hard to believe, actually. And it's a model that has guided and informed health decision makers on how do we move from a very manual, paper-based healthcare system. Remember the good old days? Think about it, comparing it to banking. We used to have our little bank books. You're maybe too young.
I had one.
We'd go to the bank. We'd put that little book in, and this dot matrix printer would write down for us what did we put in our account, what did we take out. Well, now think about that in terms of healthcare. The good old days. In an operating room, we'd have these giant white pieces of tablets, papers, where we would write in all our patients that were scheduled for surgery. Pretty time consuming, pretty labor intensive, not at all digital, and not at all efficient or productive, or even in some ways safe. If you didn't happen to read my writing very well, John, you were kind of in trouble. You know what? We have the right patient in the right operating room, right? So EMRAM was really the earliest, the first, and really one of the most dominant maturity models that has created that strategic roadmap for global health systems on how do we move into the digital world, the digital societies that pretty much at least 70% of the world's population is used to and accustomed to and are engaging in virtually every other business sector. EMRAM in particular focused on the electronic medical record. And that was one of the first enterprise level technologies that helped hospitals specifically move from all that paper-based records and record keeping into the digital space. And that digital space now becomes critically important because how do you know what patients you've given care to and what that care achieved if you don't have a digital record of it? So EMRAM has been foundational in the hospital sector. And it's played an incredibly important role to guide progress. And we've seen impressive evidence, speaking of research, for organizations, particularly in the US, who have achieved EMRAM level 7. They have statistically significant higher ratings among patients of their experiences, their satisfaction, their communication with their nurses and physicians they're working with. It has made an impressive difference in the lives of patients. And really that's what's most important in healthcare today.
Well, it's great you're studying this because one of my biggest pet peeves about all of this is that once we implement a technology, we start to take it for advantage, right? Like, you know, just something as simple, like you said, can you actually read what's on the schedule, or can you read the note? Like, once we implemented EMR, no one complained about that, but they also didn't get credit, right? Like, because we just take advantage of it so quickly, right? And so I think that's what's interesting about the maturity model too, right? Is that you can actually study and see and remember, maybe is maybe one of the most important things, right?
Well, and you're absolutely right. It's, you know, how Wolf will always say, it's people, it's processes, and then it's technology. The technology is important. EMRs are very important, but not just because they're a technology. They're important because what they allow me as a nurse, or what they allow a physician, a surgeon, a team to achieve for and with that patient. So EMRAM is evolving as the digital transformation agenda is evolving to move from, do you have an EMR? Are your teams using the EMR? And that's EMRAM 18, to today, which is EMRAM 22. What is that EMR helping you achieve, and for who? Are your patients' outcomes better? So far, the evidence, the early evidence in the US, in Canada, in Australia, absolutely it's better and stronger. Now, how do we take that data and transform it, not just for, is it achieving better for you and for your patients? Perfect. Now, does that data help us predict how can we make sure our patients stay healthy and well and don't have some of the complications or poor outcomes or safety issues that we've seen in the past? So now it's helping us, and we're, you know, focusing our attention in 22 on what outcomes is it helping you achieve? How are you using that outcomes data to inform what you can do next? Stronger systems, better care, more proactive care to helping our patients achieve their best health outcomes. And that's really the hallmark of why EMRAM 22 is now moving forward in the market.
Yeah. So, I mean, one of the things I found most interesting about EMRAM is how CIOs have like leveraged it. I think Ed Marks was the first one that I saw talk about, hey, we needed a goal that would coalesce the team and provide a roadmap. And sure, we can tweak the roadmap for our own needs, but having that goal was powerful because a shared goal achieves better outcomes and all those things. So I think that's really interesting. But you know, you talk about the evolution of EMRAM, right? You have recently announced the modernization. We'll link to that in the show notes for everyone that wants to check out the details and download more info. But tell us about those changes. It sounds like, I mean, you kind of described this move to more of an outcomes-based approach. Is that what's really being changed?
That's one of the very significant features. EMRAM 18, the more recent EMRAM, focused a lot on the functionality of an electronic medical record. Are your clinicians using it? Are the productivity and efficiency of using it helping get all the patient care delivered as those patients are needed? And that served an incredibly important purpose. But have a look at where we are today in this pandemic. Now we are front and center. What outcomes are we achieving? Who's getting tested? Who has COVID? Who's at risk for COVID? How can we prevent that COVID? Now put that and overlay that into the future. We've had 2 years in this pandemic of tracking outcomes, but our data infrastructure has not really been oriented very much to outcomes. We know who has an EMR. We don't necessarily don't know really who has those outcomes, who's figured out the best care pathway, whether it's a patient with a chronic condition, a patient with COVID and a chronic condition, a child, whomever that might be. So one of the changes is, how are you mobilizing and using that EMRAM data, EMR data, to now define what outcomes you're achieving? Across what populations? Some populations are doing exceptionally well, others are not. We saw that in COVID, right? The African American community had different outcomes than their Caucasian community. Same in Canada. even though we have very different healthcare systems. So how do you use outcomes data now to inform ways to personalize care and make sure that every patient an organization sees has the opportunity to achieve the best outcomes? That's equity, right? Making sure every patient we see in every health system in a country now has the same opportunity as every other patient to achieve best outcomes. The only way you can do that is tracking what you're achieving, using and leveraging that EMR data to know what groups of patients are achieving the very best outcomes and under what conditions. What care, what providers, what locations, what geographies, whatever it is. How do we learn from that and now apply those lessons learned to every population, every patient group that may not have achieved quite the best? We see this often. Men achieve different outcomes than women. Rural populations achieve different outcomes than urban. So EMRAM 22 guides health and hospitals in particular to leverage this outcomes data to inform that organizational strategy, to inform new ways to fine-tune and personalize care pathways to make sure all of our population unique groups have the same outcomes. The second thing it does is how does an organization use that health record data to share it with patients? In this pandemic, we've asked patients to stay safe, wear masks, minimize the risk of getting sick with COVID, right? If we don't share data with our patients, how do we expect them to make data-informed decisions?
Yeah.
It's pretty hard. Should I do this? Should I do that? Is this medication the right one? Is this medication going to cause side effects with all my others? If you don't engage your patients much more meaningfully as partners, share their data with them to inform their decisions, then they can't be as active in progressing towards their health goals as health providers would like them to be. So a second big focus on EMRAM 22, which is brand new, is how are you leveraging that EMR data, sharing it with your patients? Are patients allowed or able to report, hey, here's how it worked, here's how it didn't work?
Yeah.
So that a provider team knows how I, as a nurse now, can care for them differently, because now I know what impact and what effectiveness our pathway is having for every individual. So it's allowing us to personalize our care, right? And that's becoming incredibly important as a global citizen. I want to know what my personal health data is telling me. Help me understand my health so I can make good decisions and make the best possible decisions. I can only do that with access to my data. And preferably an ability to share my outcomes. So if this medication is not working for me, it's making me sick, I can work with my provider team to help find me the right medication. So that takes us to a level of a care effectiveness, but also efficiency. If a provider, as a nurse, if I'm always trying to guess, why isn't this patient getting better? Because I have no connectivity with that patient and I have no ability for that patient to report how are you feeling? Are you doing better? Is this working? Then I'm grasping at what could work better for that particular patient.
You'll know a month later when they come back in, right?
Exactly.
That's like a good feedback loop.
And you're absolutely right. If I'm relying on that next visit, it's a month later, it's 6 weeks later, maybe it's 6 months later. An awful lot happens in people's lives.
Yeah. And they skip the visit, right?
And then they don't come, and then I wonder what happened to them. So it's really moving towards tracking outcomes that allows us to make much more evidence-informed decisions on what's going to work best for whom, and making sure our care works best for every individual and their unique life circumstances. It engages them much more directly with our patients. Here's your progress. Help us set the health goals that you want to achieve. And as a nurse or a doctor, I'll help you reach those goals. So it engages them much more actively in their care. Why is that important? Because the majority of our patients have chronic illnesses. Chronic illnesses just don't go away with a magic pill or a magic solution, right? They have to be managed, and they have to be well managed. But we really need to engage our patients much more directly on helping them help themselves. If we just rely on in-person visits every time, and we don't know what happens in between visits, we are not positioned as a health system, in my mind, as directly as we could be in helping people help themselves. And that creates better outcomes for health systems. Better patient outcomes means less expensive healthcare. Right? If every time we prescribe something, people come back with challenges, it costs a lot of money for those visits over and over again. So it's really designed to be much more personalized, focus on outcomes, and leverage that very important data to inform decisions, not just for patients, but for their provider teams. Even at an organizational level, if I'm a CEO or a chief nursing officer, which I was once upon a time, if I had the level of data to know that program is achieving amazing results, let me learn how they're achieving it. Now I can take what I've learned over to these other 7 programs. That means all of our health services get better. Without that kind of data, it's not possible. And the other third part of that stool is if we have that leverage, that amount of data, focusing on outcomes, who's achieving best, now we can really use artificial intelligence tools, machine learning tools, algorithms that will help us predict who's most likely to get into trouble. And let me focus and prioritize that patient group and prevent that risk from ever happening. Now you're reaching into the future, post-pandemic system. We don't wait for patients to get sick. Because our data is so robust, we know who's at greatest risk. Our pathways are now preventive. We make sure those risks don't happen nearly to the degree they might have otherwise. So now you're driving population health, you're driving much more efficient, productive healthcare systems, and you're actually achieving much greater cost outcomes because better health outcomes means lower cost.
Well, that part of the stool is so important because as you talk about all that patient data about outcomes, if I'm that chief nursing officer, I'm saying, how do I do that in my busy day? Right?
Exactly. You're exactly right. And as a chief officer when I was, which was just a few years ago.
You're like, I'm just hoping to have some nurses.
You know why I was so busy?
Why?
Because I had to physically run around to every one of those patient units to say, what's going on? Who is that? Who are you most worried about? Let's figure out why. And I had to physically go there, interview, talk, show me the health indicators that are concerning. Imagine flowing that seamlessly to a dashboard on a handheld, I don't know, smartphone or tablet. And I know exactly where my priority patients and my highest risk is for, maybe staff shortages, beds not available, patients sitting in emerge. That would have made my decisions massively more data-driven, much more efficient, and much greater visibility. And that's really what EMRAM 22 is designed to achieve.
Yeah, it's a great vision. So can you give us a feel for what does a healthcare organization, maybe a few of the different stages look like from a maturity perspective? And of course, what does a stage 7 look like? And maybe you even compare what's a stage 7, 2018 version versus 2022 version. I know you have one that's already achieved that. So what would those different stages look like?
What would you see if you get to those levels of maturity, which is a great question. Many organizations today are, and I should know the numbers specifically, but awful lot of organizations are probably an EMRAM level 2, 3, 4, 5, right? They have data being collected. Patient charts are digital. They're on, digital platforms. And that data, as every patient encounter comes in, that encounter data is captured. It lives on the platform. And we tend not to do much with that data, but it's a good record to look back over the year to say, how many patients did we see? How many infections did we have? How many readmissions?
That's we can bill.
Yes. In the US, in Canada, we don't.
Yeah, that's true.
Question, but you're absolutely right. So it's a good transactional record of what we did. And that generally is what you would expect to see in EMRAMs 2, 3, and 4, more or less. In this new EMRAM 22, what would you expect to see in a level 7? Here's what I'd expect to see. I would describe it broadly as it's a learning health system. That data is flowing seamlessly to that point of care, meaning as a nurse and I'm walking into that patient's room, I know exactly what's happening with that patient. That data is cueing me or alerting me to potential risks because it has those algorithms behind the scenes telling me, oh, this patient may be at risk for a fall or an infection or whatever that may be. Those alerts tell me as a nurse, you need to think about strategies and interventions that can prevent that. So if I'm getting those alerts, that means I'm going to assess that patient differently. I'm going to engage and talk to this patient about here's what we're going to try and make sure that we prevent from ever happening. It is also a patient who has access to that data and some learning tools that helps them understand their conditions better. It is also a system where that patient can report back to me, oh, that medication really helped. I feel so much better. Or that pain medication didn't really help. Is there something else? So it's a system where data flows right to the point of care, whether I'm the nurse or I'm the manager of that particular inpatient unit, or I am the CEO or chief nursing officer over all of those programs that are delivering care to know exactly what patients do we have, what patients are at risk that need to be prioritized so we can prevent those risks. How do we make sure every one of those patients achieves the best outcomes, and that data flows seamlessly from the point of care right up to the C-suite to know how they can optimize their current care delivery with their current workforce and teams to make sure every patient has the best outcomes. So it's a very data-driven environment, very evidence-driven, but that data is flowing in proactively in near real time. And patients are part of the care team, and they are mobilizing their data to help make the decisions that are best for them with the support of their care team. That's what a level 7 organization is able to achieve.
Yeah. It's beautiful how far we've come from a billing engine to something much more robust, clinically oriented. So
and much more person-focused, person-enabled.
That's true.
How are we now part of your strategy to stay healthy and well and have the quality of life that you want to achieve? And that, for me, that's really driving our strategy at HIMSS and EMRAM 22.
Yeah. So what does it mean for someone who's already, achieved a certain level of EMRAM, maybe they're a level 7, right? You kind of pulled the rug from them. No, I mean, so like, do they need to do it again? Is there a gap analysis approach, or what does it mean for people?
That's a great question. We worked with a lot of our current level 6s and 7 organizations because, of course, as you refine and you upgrade or change or modernize a model, you have to make sure it's going to offer value to your current clients that you're working with, as well as those you haven't worked with and want to progress. So we started with our level 6 and 7s, and the feedback they came back to us was, you know what, Anne? With this model, we won't maintain our level 6 or 7 status. We have some work to do. And they've all said to us, we need this motivation, this incentive to do that work, because patients and engaging our patients new ways and differently and helping them help themselves is so important. So for organizations that are already using EMRAM, this now helps them move from today to that future post-pandemic health system that pretty much every global citizen hopes for and would only dream to expect, that they have partners in their care. So for our existing, we've tested it heavily, I think over 30 in many different countries, to make sure they saw the value. And the value they came back to us over and over again was, it's helping us move to that outcomes data-driven environment we really only thought about, but now we have a roadmap to help us move forward. And it's really helping us be much stronger in meaningfully engaging our patients rather than just sharing information with them as we go. For those organizations, it's really expanding and building on the tremendous strengths really they've already achieved and building towards a much more robust, high-performing, personalized, person-centric health system focused on outcomes. For organizations who've actually never looked at EMRAM, there are many countries who are less familiar than the
Sure.
US actually with EMRAM, and they're asking the question like, why do we need this? Well, the pandemic has helped answer that question. Those are the countries that just don't have data to help them make decisions on, okay, which of our patients are at greatest risk when we find ourselves in this pandemic? How do we find them? An interesting comparison, Canada is not a digitally advanced healthcare system compared to other countries. Early in the pandemic, Taiwan is exceptionally digitally mature. They have a national data infrastructure that identified every citizen that was at great risk for COVID. They supported isolating them and wrapping home care supports around so that they they reduced their risk of getting COVID. Their numbers of COVID cases, much lower than Canada's, simply because they had the data infrastructure to identify who's at great risk, how do we prioritize them to keep them safe, and work with our population to get through this very challenging pandemic. So for many countries, many regions, many organizations who've not used EMRAM and other maturity tools, they now realize just how important that digital infrastructure is. And they're all, once they understand what the maturity models are, really moving forward with adopting and using them as the guide, the roadmap, if you will, to a much more digitally enabled health system.
Yeah. Well, I think any organization that's achieved level 7 and doesn't want to keep moving the ball forward would be a travesty, right? So
well, the other important part of those level 7 organizations is how do we help all the other organizations that are not level 7 learn from them?
Yeah. Especially because it's connected often, right? They're partners, they're referring.
It's very connected. And why would any organization want to have to relearn those hard lessons learned that those others have already learned? So the other motivation here is, how do we build a learning community? If we have, I don't know, 100 level 7 organizations and they're all willing to share, let me share with you at level 2, 3, how we solve that problem. Now you can accelerate digital transformation. So we're finding that's actually an incredibly effective tool at bringing communities together of level 7 expertise in different countries to help them accelerate their transformation, because the whole world needs much faster progress towards digitally enabled learning health systems. And if we can learn from each other to make that faster, we should.
Yeah, no, I saw that firsthand at a conference we organized, a health IT event where UPMC and someone from Stanford Medicine were all in the same room. And for all practical purposes, they do not compete in any way, shape, or form with each other, right? You know, maybe in this new virtual world a little bit, but not really. And so they were happy to share and learn from each other. So I think that's powerful.
And most everyone is actually. I've never found it. What much of this collaboration is happening across jurisdictions. So if Hong Kong has figured out an incredibly interesting digital strategy that the US or Canadian or Germany or UK are struggling with, they're more than willing to share, because chances are really good those other countries have figured things out that Hong Kong
that they can share back.
And that's the learning health system concept that HIMSS is really so well positioned to achieve.
Yeah. So as we wrap up, what does all of the EMRAM mean for patients? I mean, you've hinted at a few things, but I'd love to hear, what do you think the impact is on patients of kind of, achieving these higher levels of maturity?
That's a wonderful question. And it's really the hallmark of EMRAM 22 is meaningful engagement between patients and their providers, being able to quickly and easily share outcomes insights, what's working, what's not working. It's allowing us, instead of patients being just recipients of care, being partners and guiding and driving their health journey with the support of their providers. It means access to all of your own data and the health literacy tools to understand, what does that lab result mean? What does that imaging picture tell me? So it's mobilizing people, and patients are already there. I mean, we all ascribe to apps in the consumer space to help us guide our health journey. What EMRAM 22 is now being able to achieve is, how do we engage our patients in those digital societies we all live in much, much more meaningfully, to support and enable them to achieve their health goals, not just those procedural or transactional goals based on best practices. It's much more meaningful, much more personalized, much more focused on health, wellness, staying healthy and well, rather than call us when you get sick and we'll try and help you.
What's slightly sad about this is I think many patients thought this is what healthcare was doing all along. So in some ways, this is achieving a vision that patients have thought was already happening and it wasn't, right? So in that way, it's a good change.
Yeah, absolutely. And, patients, people, what I think healthcare, the reason for part of that struggle is, look at every other business sector. Banking, I mean, how many times do you go to a bank these days? Not much, because everything's digital. It's consumer focused. It's really easy. Travel. We don't go to travel agents anymore. We sit down and we book it. It's completely connected. I mean, they will send us a notice if your flight's a half an hour later, an hour, whatever, right? Every other business, retail, Amazon, all of those companies, every other business sector has moved into the digital space. What we're now seeing in healthcare is consumers expect the same from healthcare. Healthcare hasn't got there as quickly as every other business sector. And that gap has gotten quite a bit bigger, I think, especially over this pandemic. And it's much more clear now, really, than it ever was for patients. The demands among our citizens, I think, will be higher than it ever has been, to your point. And maybe it's kind of sad it took us this long to get there. But healthcare is a very complex and a very different sector than retail, banking, travel, all those other things. So, but now is healthcare's time. Yeah. And in order to get there, you need the roadmap. You need the evidence. This EMRAM 22, I should have said earlier, is all based on best evidence in the literature. It's not just about a great idea. It's what's the evidence telling us patients want, what health systems can achieve, what digital tools, technologies, platforms can offer. So it's really giving organizations, health systems, those guideposts as to what you can achieve, how you can get there, and what are the strategies you can consider to do that.
Yeah, well, thanks so much for sharing, Anna. I think that is exactly the perfect description of EMRAM, is trying to provide a roadmap for where you should take your healthcare organization as a health IT leader. So appreciate you taking time and sharing all the changes and modernizations to the EMRAM model. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. And also check us out on your favorite podcasting social media platform. Follow along, like, and subscribe. Thanks, Anne.
My pleasure. Thank you so much for those great questions. Very much appreciate it.